The Fund for Public Health in New York was involved in a broad range of problems from the moment of its founding. That includes managing hospital preparedness activities so that hospitals throughout New York City could be better prepared for something as catastrophic as the COVID pandemic. It was also a partner in bringing together public and private entities to support big changes that have made New York City safer, like going smoke-free, making all restaurants trans fat-free, and mandating calorie postings on chain restaurants. In each of these areas, there were private grants, research, evaluation, and the Fund for Public Health allowed quick action. Now, fundamentally, what the Fund for Public Health in New York does is to accelerate, to allow New York City to remain at the forefront of innovative changes to protect, preserve, and promote health of all populations, all communities. Congratulations on many years of success and best wishes for many more years of health progress.
During my time, the Fund for Public Health in New York did two things. First, they enabled us to innovate and to move fast so that we could do things that couldn't easily be done within a normal government system. And second, the board served as a kind of informal advisory group to me. The New York City Department of Health and Mental Hygiene is among the most highly regarded health departments in the nation. They can't function and serve as this leadership role without an organization like the Fund for Public Health in New York. So let me just say thanks again to everyone that's made that organization work. Keep up the good work of helping New Yorkers live long and healthy lives.
Congratulations to the Fund for Public Health of New York City on its 20th anniversary. We really could not have done our work without the Fund for Public Health of New York City. It enabled us to innovate, to accelerate innovation. And in my case, I owe a particular thanks to the Fund for helping us advance the cause of racial equity and social justice as guiding themes for the City Health Department, themes that remain in place today. So thank you. Hats off for 20 years, and let's get started on the next 20.
FPHNY, congratulations on 20 years of helping to protect and promote the health of New Yorkers. You have built a reputation of strong partnerships with smart, committed public health professionals to do innovative things through every commissioner transition. When I became health commissioner and chair of FPHNY in 2018, one of the first things we did was refocus our development portfolios to align around healthy mothers and babies and fighting epidemics. Good thing we did, because September 2018 began the worst measles outbreak in New York City in over 30 years. And then in early 2020, we were thrust into COVID first wave response, where you were incredibly helpful, especially in obtaining grants that quickly helped us update our technology for tracing outbreaks. Thankfully, it wasn't all about communicable diseases. Critical among the ways in which FPHNY was helpful to meeting the public health challenges of the day was helping us stand up and sustain naloxone distribution to address the opioid overdose epidemic. Also, there were a variety of grants related to standing up the Maternal Hospital Quality Improvement Network to address disparities in maternal morbidity and mortality. FPHNY, thanks for great work over the last 20 years, and I wish you much success for another 20 years and beyond.
The core values of public health are clear. Values like science and equity and compassion. And those values are never more anchoring and never more important than during a public health emergency like the COVID-19 pandemic. This is because shared values lead to effective and swift action. We saw this during our COVID-19 response, when the Fund for Public Health worked hand in hand with the health department. For example, ensuring that equity was at the center of our historic vaccination campaign, channeling resources to community-based organizations through the Vaccine Equity Partner Engagement Project. The legacy of the fund, that strong foundation that has been built over the last 20 years, meant that it could leap into action. I can't wait to see what new frontiers the next 20 years of the Fund for Public Health will bring.